Good evening, everybody. I'm very happy to join you in this wonderful scientific day, Congress. With you, Dr. Ahlam Abdulsalam, lecturer at Faculty of Pharmacy, Gharyan University, Libya. Is my screen clear?
Yes, it's visible. You can start.
Okay. I'm very happy to join you in this wonderful scientific Congress. With you, Dr. Ahlam Abdulsalam, lecturer at Faculty of Pharmacy, Gharyan University, Libya. Also, I'm dermatologist in Ahlam Medical Center for Dermatology and Cosmetology. The current study represents treatment of old world cutaneous leishmaniasis with paromomycin cream, oral dapsone alone, and in combination in Algabal Algarby Libya. Under supervision of Professor Ali Othman al-Daiki, Professor of Immunology, Faculty of Medicine, Tripoli University, lecturer at Libyan Academy for Postgraduate Study. Introduction. Out of 20 neglecting tropical disease, leishmaniasis rank in the top of 3 among those caused by protozoa. Due to limited resources devoted in control, diagnosis, and treatment. Also, due to a strong association between poverty and social problem. Cutaneous leishmaniasis is endemic disease in 88 countries, particularly subtropical and tropical area, and has a significant economic and health impact. Leishmania is an intracellular parasite belonging to trypanosomatid family of protozoa. It consists in about 20 species transmitted by 90 species female sandfly. Classification of old world cutaneous leishmaniasis: acute, chronic, and diffuse. There are 2 forms of acute cutaneous leishmaniasis: dry urban form, which caused by Leishmania tropica, and wet urban form, which caused by Leishmania major. Today we'll be talking about the treatment of the wet rural form because this type is endemic in my country, Libya. There are 3 things that should be available to cutaneous leishmaniasis to be occur. Fat sandrat, which is a reservoir of cutaneous leishmaniasis, female sandfly, which is a vector, and the human, which is a host. Pseudomonas opaceus. Pseudomonas opaceus, it's the reservoir of cutaneous leishmaniasis. It's not a house mouse. It's a scientific name of fat sandrat. The average life of this rat from 14 months to 4 years. Pseudomonas opaceus mostly found in North Africa and Middle East. It lives in sand desert, but may be found in terrain, rocky, and saline marsh area. It has from 25 to 35 centimeters in its length and from 32 to 43 grams in its weight. Pseudomonas opaceus is very selective in their diet. It prefers seeds and vegetables, but the honeymus or a triplex honeymus is the main meal for him because it has a large, because this plant has a large amount of water. Now let's go to talk about the vector of cutaneous leishmaniasis, which is a female sandfly. The vector of leishmaniasis, this fly, it has from 2 to 3 millimeters in height, and it has about 1/4 size of mosquito. It has a hairy V-shaped wings with large black eyes with long slit-like legs. It has average lifespan 30 days. There are 700 species, but 70 species believe transmitted the disease, and 20 species certain that transmitted the disease. Female sandfly is a blood feeder. It requires the blood as a protein source to completion the egg development. Unlike male sandfly, which not a blood feeder and is a feed only on plant nectar only. Female sandfly lay from 30 to 70 eggs, spreading them around several sites. These eggs hatching after 1 to 2 weeks, but if the condition too cold, the eggs enter into diapause. When female sandfly injected the infected stage promastigoid into the human during blood meal, the promastigoid would be engulfed by macrophage, which transfer into the macrophage to a tissue stage, which we called a mastigoid, which divided by simple division to infect another macrophages. Diagnosis of cutaneous leishmaniasis. History if patient lives in endemic or coming from an endemic area. Clinically, initially the lesion appear as erythematous papules, usually on uncovered areas such as face and extremities. Then this papule break to painless ulcer with well-demarcated edge and raised border. Finally, the breast scar is the final result of this lesion after healing, which considered as a major problem for this disease. Dermoscopic. Now, dermoscopic can be diagnosed some cases of cutaneous leishmaniasis by dermoscopy because there are two diagnostic pictures by dermoscopy. The first picture is central erosion surrounding by coma-shaped regular blood vessels. And the second picture, erosion scar surrounded by burst-like pattern with dots and hairpin blood vessels. Slit and smear with Giemsa stain to show a mastocytoid form. Long-standing treatment for cutaneous leishmaniasis. Still, meglumine compound is the major cornerstone to treatment of cutaneous leishmaniasis. In current study, I use paromomycin cream 15%. Paromomycin cream, as we know, is aminoglycoside antibody. I prescribe to the patient once per day. The mechanism of action of this cream inhibition the protein synthesis of protozoa, which to decrease the proliferation rate of leishmania. Also, I use the dapsone tablet 100 per gram per day. Dapsone is a diamine diphenyl sulfate, which is an antibiotic using to treat a variety of dermatoses. In the mechanism of action of this drug by influence the classical pathway of complement system, which lead to post the cellular immunity. And because of some side effect of this medication, I prescribe to home patient some investigations such as CBC, glucose 6-phosphate, and LFT before enrollment in our study. Aim of trial: provisional medication to assess and compare the response, efficacy, and safety of paromomycin cream, oral dapsone, and their combination treatment in cutaneous leishmaniasis. Methods and material. This study is a prospective, randomized clinical trial carried out at a private outpatient Al-Ahlam Center for Cosmetology and Dermatology in Gharyan City between a period 1st January 2020 to last December 2021. It includes 45 patients divided into 3 groups randomizedly: paromomycin treated group, dapsone treated group, and paromomycin and dapsone treated group. Inclusion criteria: all patients diagnosed clinically as a patient with cutaneous leishmaniasis, and slit and smear done to all patients to confirm the diagnosis. Exclusion criteria: I excluded a pregnant female, lesion adjacent from the eye, immune-compromised patient, and patient long-standing on corticosteroid. This questionnaire was filled by all the patients in whom the study before enrollment into the study, which include demographic categorical data such as age, sex, etc. And finally, all patients given written consent before enrollment into the study. Analysis of data. Results. Analysis of data was done by using a statistical program for social science version 18. Quantitative variables were represented in form mean and standard deviation, while qualitative variable was performed in form percentage and number. Null hypothesis: both paromomycin and dapsone alone or in combination have the same results. Alternative hypothesis: combination of both drugs will be more effective in treatment of cutaneous leishmaniasis. There was no statistical specific difference in outcome of 3 groups. During first month, only 14.3% of patients were cleared in paromomycin and dapsone treated group. During second month, 42.8% of patients were cleared in dapsone treated group, while 28.6% were cleared in paromomycin and dapsone group. During third month, 42.8%, 57.1%, and 57.1% were cleared in paromomycin, dapsone combined group respectively. And during 4 months, 57.1 patients were cleared in 3 study groups. So the p-value was 0.4, so I would be accept the null hypothesis. I used vertical bar chart to explain the percentage of improvement among 3 groups, which reached to 57% among the 3 groups after 4 months. The current study in agreement with Iselian et al., who demonstrated the uses of paromomycin cream be effective in treatment of old-world cutaneous leishmaniasis in Iran. Also, the current study in agreement with Ahlam et al., who demonstrated when multiple lesions is present should be used combination topical and systemic treatment to achieve a good result with a rapid response. Finally, I will represent to you some cases in our study. First patient is a middle-aged female patient treated with dapsone tablet. This lesion is a painless solitary ulcer in the right lower extremity, and this is after 1 month from use dapsone tablet. Only the obvious regression of ulcer obviously occurred. And the second patient, 10 years old, child treated with paromomycin cream, and he had completely improvement after 3 months from use this cream. The third patient was 50 years old, male, treated with paromomycin cream and dapsone. This patient has a multiple lesion on the right hand, and just after 1 month from combination treatment, patient completely improved. And finally, 35 years old male treated with paromomycin cream and dapsone combination. And due to present a secondary bacterial infection, this patient completely improvement after 4th month from used the combination treatment. Conclusion: using of paromomycin and dapsone combination in treatment of cutaneous leishmaniasis shows better result and early clearance of cutaneous lesions, whereas using of topical paromomycin cream or oral dapsone alone were effective. Also, our results showing that paromomycin is effective, safe, and well tolerated in children. Thank you.